Hi everybody, it's Dr. Tracy. Today I thought we would walk and talk about some of the comments I've been getting on YouTube. The first thing I want to talk about today is glucose testing, because this is a question or a comment that came up a lot. And I particularly appreciate Patricia, whose comment was basically a rant about how we test for diabetes in pregnancy with glucola. She feels like the glucola itself gave her problems because A, she was allergic to some of the components of it, but B, she just felt so awful after drinking it. You're not alone because a lot of people don't like glucola, and it doesn't make you feel very good because it's a lot of sugar. But the fact is that this is what we do to test for diabetes because it's exactly 50 grams of glucola, so we know from testing thousands of women what glucoses ought to be or what range they ought to be in after drinking it. There are, however, alternatives to glucola. There's been a study that looked at using jelly beans, not the little jelly bellies, but the big Brock's jelly beans to test for diabetes in pregnancy. Another study came out more recently looking at Twizzlers, 10 Twizzlers, which is the equivalent of about 50 grams of glucola. It sounds like a much more fun test, but try eating 10 Twizzlers within 5 minutes and then see how you feel. The other alternative to glucose testing is just doing glucose testing with a meter that you buy or have prescribed for you. Just check your glucoses first thing in the morning and 2 hours after you start each meal for a period of about 2 weeks. And if they're all normal with you living your normal daily life, then chances are you don't have diabetes in pregnancy. This is a really popular way to test, even though it takes 2 weeks rather than just an hour, because there are a lot of people who don't tolerate glucola. People who have had weight loss surgery in particular, they can have what's called dumping syndrome, where you drink anything really sweet and then you just feel miserable for hours. You can have nausea, sweats, chills, diarrhea. So for people who don't like glucola or don't tolerate glucola, or who just don't want to put that in their bodies, having a glucose meter prescribed and just checking your blood sugars for a couple of weeks can be a really good alternative. The advantage of that is that it looks at what your glucoses are doing in real life rather than what your glucoses are doing after drinking this nasty sweet drink. So thanks for the comments. Several videos, walks and talks are coming up regarding a lot of the comments I've received. Keep them coming.